If your MRI or X-ray report mentions foraminal stenosis and you're left confused, you're not alone. This hidden cause of leg pain and sciatica symptoms has left thousands of patients in the dark. But here's the good news. After 30 plus years of treating patients just like you, I've developed a 7-step non-surgical, non-drug process that's proven to work. And in this video, I'm going to show you exactly how to get immediate and lasting relief without going under the knife. Over 3 decades, I've treated thousands of patients suffering from spinal degenerative conditions like foraminal stenosis. Not only have these methods helped them walk pain-free again, but they're also backed by extensive research and clinical success. My unique 7-step approach has consistently proven to restore strength, stability, and relief even when other treatments have failed. Here's what makes this different. Unlike most treatments that only address surface symptoms, this process targets and corrects the hidden causes of foraminal stenosis. By following this breakthrough 7-step treatment process, you'll finally understand what your MRI report really means, identify which treatments are missing from your care plan, and most importantly, know exactly how to relieve the pain, restore your strength, and achieve lasting relief without the fear or risks of surgery. In this video, I'll walk you through each of the 7 steps. Step number 1 is a patient favorite because it sets this process apart from other treatment protocols. Each of these steps builds on decades of clinical research and experience designed to speed up your healing and ensure you get relief faster. The key to lasting relief is knowing whether your current treatment plan is addressing all of these critical steps. If you're missing even one, it could be the reason why your pain persists. In the next few minutes, I'll show you exactly what to ask for, what to look for, and how to implement this proven strategy to regain control of your health. Watch this presentation now to get immediate clarity on your condition, discover the 7-step plan that's already helped thousands of patients, and finally start your journey to pain-free living. I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been doing this now for over 30 years. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash the subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and without surgery. I upload a new video every week. In addition to that, I've created a free Health Vault. It's a collection of exclusive videos that gets delivered to you each week with trusted health knowledge and lifestyle hacks. You can get it at the link in the pinned comment below. I'm going to dive into my 7-step non-surgical treatment process in a minute. But first, it's important to understand that foraminal stenosis can result from several factors. Before we get into that, let's take a look at actually what we want. So remember, this is what we want to see in our spine. We want vertebrae, we want nice thick disc, there'd be another vertebrae. The disc serves as a number of different things, cushioning, support, but what it really does is it creates space for the nerve to come out. So that's the yellow guy you see coming here. That nerve comes right off the spinal cord, and it's that opening where that nerve exits is what is called the foramen. Okay? Foramen just means passage or opening, especially in bone. And in foraminal stenosis, we have something that compresses that or narrows that opening in there. Again, stenosis just means narrowing. So that can come from a disc bulge or a disc herniation. So disc bulges or disc herniations, you can see on this model here, is you can actually start to see part of the disc start to bulge out or herniate. And when it does that, it's going to put pressure on that nerve. That's one thing that can cause foraminal stenosis. Another thing is what we refer to as ANTEROLISTHESIS or RETROLISTHESIS. So that's when the vertebrae literally start to shift either forward or backwards on one another. And if we do that, that's also something that then is going to enclose that opening or make that opening narrower, which again is going to put compression on that nerve. Degenerative disc disease can certainly do that. So let's take a look at this model. This is a more advanced case where not only does that disc thin out, but you now start to get what we call spurs or osteophytes. So that's bone growth, and that bone growth can also enclose or narrow that opening where the nerve exits as well. All of these things, degenerative disc disease, degenerative joint disease, osteoarthritis, they all mean the same thing. All of these things are typically can cause foraminal stenosis. They're typically the main causes. There are other causes as well. Foraminal stenosis typically causes what we call radicular leg pain. So remember, radicular just means a nerve pinching type of pain, like sciatica, which is one of those types, but also can be different from just a straightforward nerve pinch as well. It can lead to numbness and tingling in the legs and the feet because that's where that nerve goes to as well. Now, if the problem worsens, it can cause what we call neurological compromise. So that can lead to issues such as muscle atrophy. So muscle atrophy means the muscle literally starts to shrink. If you want to kill a muscle, you cut the nerve. The nerve is what supplies that muscle. It can also cause leg weakness, obviously. It can cause what we call foot drop. So foot drop is, think of if you wanted to raise your foot or ankle towards you. Foot drop is something where you can't do that anymore, and that's important. Just even things as simple as walking, you'll literally find that the foot will drop, hence the term. If you're experiencing leg pain from foraminal stenosis, the first step is to identify all of these causes, and that's exactly where my process begins. So let's dive in. So the number one step is actually what I call step 0. The reason why I call it step 0 is because it's the consultation and examination. It is of essential importance that a thorough consultation and examination be done. We just told you how foraminal stenosis can come from so many different things: disc herniations, disc bulges, degenerative disc disease, spondylolisthesis, which includes anterolistesis and retrolistesis, a whole bunch of big fancy words. But to best treat it, to actually fix this, we need to know what the underlying causes are. And how on earth do you ever do that if you haven't done a thorough exam? You need to find all of the underlying causes. And yes, it's causes, it's never cause. People come in thinking they have one thing. They'll show me their MRI report. Hey, I've got an L4-5 disc herniation. That's causing all my problems. And I can guarantee you in 30 plus years, it's never just one thing. So that's of key importance. So in our consultation and examination, you are with me for an hour one-on-one. We cover everything. We're looking at ranges of motion, orthopedic tests, neurological tests. We get into some very significant high-tech toys, which I'll show you in just a second. Consultation is of key importance. Most people know a lot more about their condition than sometimes they even realize, and that's up to the doctor to actually figure that out. We want to know, how your problems developed in the first place. All of that is going to help us in coming up with the best solution for you. 2 key important things that we do as part of that initial consultation and examination is what we call a full spine nerve scan, and also what we call diagnostic digital X-rays. So what we're looking for in a full spine nerve scan, think about this: whether it is the disc herniation, the disc bulge, the degenerative disc disease, the anterolistesis, all of those things are putting pressure on the nerve. What on earth makes more sense than to find out what's happening to the nerve? And that's exactly what a full spine nerve scan does. So this is a cool thing. We don't need to wait 6 months for an MRI. All of this is within my health center, all of these high-tech toys, as I call them. So what we're looking for, the technology out of this actually comes out of the scientists down at NASA. And what it is it literally has the ability to measure the electrical activity that's going on in the spine and the nervous system. So what we want to see here is, you can see here, we have normal. Normal is all green, so we color code it to make it easier for you to see what's going on. Green means we're getting a normal amount of electrical activity in the spine and in the nervous system. That's what we want to see. When that's happening, we have normal nerve flow. We also have normal muscle function, because again, the muscles are also controlled by those nerves. Look here in this particular person's scan, you're going to see a whole bunch of different colors now. So now we're getting the pink, the sort of purple pinks. That's an indication that there is too much interference or obstruction to those nerves. You can see this yellow down here. That's an indication there's actually not enough electrical activity for normal muscle function. And last but not least, see all the red through here? That's all extremely excessive dysfunction happening to the nervous system. That's what's going to happen in a case of foraminal stenosis. That's going to happen in the case of a disc herniation or a disc bulge or spondylolisthesis. These are all things that are measurable, and if we don't know what's going on in the first place, how do you ever treat it? Most people have 4 or 5, as I said, 6 different things going on, and if they don't even know those 6 exist, then they're never going to get better, because they're not addressing the underlying causes of the problem. What's really interesting with all the testing that we do in our initial consultation and examination is we don't use it just to finally figure out what's going on with you. We also use it as a baseline. So at the end of any of our programs, redo all of these tests so that we actually see functional improvement. This is not something where we want to cross our fingers and hope you get better. We actually want to know that we're making changes in there, that you're getting the functional improvement. Another key component of our initial consultation and examination are digital x-rays. These are what are called high-frequency digital x-rays. They're used for diagnostic purposes. Please, if you have some type of serious issue, if you have foraminal stenosis that's being caused by disc herniation, disc bulge, degenerative disc disease, spondylolisthesis, x-rays and possibly even an MRI are mandatory. The number of people that we see who've never had any what we call imaging done just blows me away. Again, if you don't know what's going on, take a look at this person in particular. You can see, okay, that the spine is not straight. There's a curve in the spine. That's what we refer to as scoliosis. Have we seen worse? Absolutely, but we're not trying to compare it to the worst. You can see significant spinal misalignment throughout all of the what we call the lumbar spine as well. If we go to the side shot, we want to see nice thick spaces, and you can see that there's not a thick space there at all. That's degenerative disc disease. You can see up here, these are what we refer to as spurs or osteophytes. So those are the pointed edges that you're seeing going on there. All these are critical to know how, again, I don't want to sound like a broken record, how do you fix these things if you don't even know they exist? It is important when you get x-rays done, such as this is why you come to a clinic like ours. You want these x-rays, and it's one of the big differences, is you want these x-rays done while you're standing. Most hospitals, a lot of medical clinics will take an x-ray while you're lying down. We want to know what's happening to the spine while you're actually using it. This is of key importance. Sometimes we may even get into what we call a motion study. So we actually want to take x-rays while you're in movement. We want to know how your spine is functioning. These are all key differences that we do in here. And this is one of the reasons why our success rate is so good. We need to know what's going on with you to be able to formulate a plan that's finally going to fix you and give you the long-lasting relief that you're looking for and bring you back to the life you deserve. Step number one, and really, again, all 7 steps are essential, but step number one is the patient's favorite because it's really something they can't get anywhere else. There are only 12 clinics in the world that have what we refer to as non-surgical robotic laser spinal decompression. We are the only one in Ottawa that actually provides this service. So again, we've talked about this before. You've got pressure on the nerve, on the disc. What on earth makes more sense than to take the pressure off the nerve and the disc? That's what non-surgical robotic laser spinal decompression is going to do. It is completely different than traction, which is just more of a stretching effect. It's going to be different than standard spinal decompression because in a lot of those cases, sometimes that can be of benefit, but in a lot of cases, the body is going to resist against this. So non-surgical robotic laser spinal decompression is a combination of setting the exact appropriate tension for spinal decompression, the exact appropriate robotic laser pattern, so none of this is ever guesswork. The intensity of the laser. The class 4 laser comes right from underneath the system. There is an opening here where class 4 laser comes out. Class 4 laser is the highest level of laser that's approved by Health Canada and the FDA. It is a relaxing form of care. There is nothing scary or spooky about this at all. We are literally starting to get to the underlying cause of the problem and looking to give you long-term relief. So robotic laser spinal decompression done non-surgically without the use of any drugs. And what we're getting is this is going to create a negative pressure inside the disc. So this is what you need. You need a negative pressure. Simply stretching or traction or inversion do not create a negative pressure. That negative pressure creates that vacuum effect that's going to pull fluids and nutrients back into the disc. And in doing so, you're actually going to get long-lasting relief. It's going to rehydrate the disc. This disc, when healthy, is 86% water. When you've degenerated it or compressed it, you don't have that. So you can try all the things in the world, but if we're not rehydrating that disc and getting the water back in the disc, and no, you can't get that just by drinking more water. And what's so specialized about this is the two work hand in hand. So the more we get true spinal decompression, the deeper the laser gets. The deeper the laser gets, the more we can get true spinal decompression. Everything we do in our seven-step program works hand in hand to actually get to the underlying cause of your problem. Step number 2 is that's great that we've actually done that for you, but then what's happened is your body has been so used to being out of whack, for lack of a better term, that you've created what we call faulty movement patterns. So one of the things that we'll see in a lot of people is they are guilted, they are faulted, they are said, oh, look, just suck it up, everyone gets some back pain or neck pain. That's not what we're talking about. We're talking about debilitating back and neck pain. So step number 2 is what we call neuromuscular re-education. This goes way beyond just going and doing the top 3 core exercises. I think a lot of you know my background. I founded the rehabilitation program in Ottawa at the Ottawa Sports Science Center. I've dealt with some of the world's best athletes. Going and doing the top 3 core exercises is not going to fix this. In fact, in a lot of cases, you're just putting more pressure on something that already has too much pressure. Your brain has changed the way that it actually uses these muscles because you've been so dysfunctional for so long. So again, in step 2, what we do are targeted exercises specific to you that actually get the brain working again the way that it should and re-educating your neuromuscular system. This is of key importance, not just to actually change how your body is wrongly compensated. Your body's trying to make the best of a bad situation. So when I say wrongly compensated, it's doing the best of a bad situation, but it's still a bad situation. We need to bring you back to normal, because if you keep doing that same thing over and over and over again, it's what we call a faulty movement pattern. So this is not something you get online. This is not someone, in some clinic putting you on the average exercise for the average person. Everything is specific to you, but also at its appropriate place and time. Step number 3 is what I refer to as disc replenishment and healing protocols. Now, these are necessary if you want to optimize your recovery. We use targeted science-based nutraceuticals that are prescribed specific to your condition. Now, let's start putting all this together. I just told you in non-surgical robotic laser spinal decompression how one of the goals is to create that vacuum effect that pulls nutrients into the disc. Well, the body's capable of creating those nutrients up to about age 40. And after age 40, it has a very difficult time doing that. So we could have you on the best system in the world, but if there are no nutrients in your body to be pulled in, you're not going to see the results that you want. So instead of the Tylenols and Advils and naproxens and opioids and injections, why not give your body the nutrients it actually needs to heal? So again, this is going to be specific to each individual, but in general, our acute one is a natural anti-inflammatory. We need to bring the inflammation down. Our OA Max are the very specific nutrients that your body needs to rebuild that disc that has degenerated. Nerve Regen Max is a specialized formula that is actually going to help your body regenerate those nerves to actually give the body the energy to fix the damage that's happened to those nerves. So important in cases of compressed nerves and sciaticas and radicular pain and so forth. And then even our magnesium 7 is a very specialized form of magnesium. Different types of magnesium will do different things in the body. What we want is we want something that's going to ease the muscle, that's going to heal the nerve, and in fact even improve your sleep. That's part of the whole cycle of repair and recovery. Step 3 is essential to getting your body to optimize its recovery. Step 4 is essential. All the steps are really essential. And this is something that you really have to go to a good neurofunctional chiropractor or corrective care chiropractor to get this done. Number 4, what we want to do is we want to do what we call neurofunctional corrections. So again, if we think of the non-surgical robotic laser spinal decompression as doing the main movement, think of neurofunctional correction. This is going to be a highly specialized procedure done by a neurofunctional chiropractor. Think of that as more the fine-tuning. So a vertebrae are subluxated, which they are in this case, where they're jammed and misaligned and pinched. That puts pressure on the disc, that puts pressure on the muscles, but the biggest thing it does is it obstructs the nerve. And so in a neurofunctional correction, what we're doing is we're going specifically to the areas that are misaligned or subluxated, and with a very quick, very gentle, incredibly skilled and safe procedure is we are starting to unjam that, to restore that function, that movement, to take the pressure off the nerve, to give tone back to the nervous system itself. So again, more of the fine tuning. That's step number 4. It is essential. And again, though, it's got to be done by someone who's done a thorough exam. To be very simplistic, one of the smartest things in the world you can do if you have a disc herniation in there is to adjust this in a direction that takes pressure off the herniation. If you have not done a thorough exam, one of the dumbest things in the world you could do would be to move that vertebrae in a direction that puts pressure back on the herniation. See, that's why all the steps are so intertwined and so important that they all be done. Step number 5 is what we call muscle tissue restoration. So what happens is when you have been like this for a long period of time, the muscles are going to start to form what we call fibrous adhesion or scar tissue. So think of it, if you were to cut your arm, you're going to get a scab that's going to form, but that scab will eventually fall off. But when that scab is there, it's going to change the texture of your skin. Same thing's happening on the inside, and this especially so post-surgery, where there's going to be significant scar tissue formation. Some of that is necessary for proper healing. Unfortunately, there's no way that any surgeon can actually control that, and if that becomes excessive, that also creates a problem. So we need to restore your muscle tissue back to the way it should be. The main form of treatment we do is something called active release techniques, which is fantastic for that. But again, you need to diagnose exactly what's going on. Step number 6 is what we call lifestyle factors. So what you do in the real world is going to have an impact on what's happening to you. So lifestyle factors could be everything from making sure you're eating a anti-inflammatory diet, making sure you're not spending 18 hours a day in front of the desk or computer. If you are, teaching you how to do that properly and how to take, the appropriate breaks and so forth. If you're someone who's baling hay all day, how to do that properly to lift and avoiding the twisting and ways that you can modify things and so forth. And finally, step number 7, we've alluded to already as well. Again, none of this is hope. This is all a very specially crafted, design program specific to you. We don't fit you into our program. We design a program specific to you and your underlying causes to get you the health goals you want and to finally get you back to the life that you deserve. We see this all the time, people who think they've tried everything and people who've given up hope. And guess what? We're giving hope back to you. What makes these 7 steps unique is the specific order in which they're done, the use of non-surgical robotic laser spinal decompression, and the fact that it's delivered in a multimodal fashion that looks at all the underlying causes of your problem. Now that you've learned the 7 steps for non-surgical treatment of foraminal stenosis and related leg pain, be sure to look for a neurofunctional chiropractor who offers these methods. There are only 12 clinics in the world that offer this type of non-surgical robotic laser spinal decompression. If you need help finding one, let me know in the comments below. And if you're in the Ottawa area or anywhere close, check out our center. We're the only health center in Ottawa that offers non-surgical robotic laser spinal decompression as part of our neurospinal restoration program. Now I want to hear from you. What has worked in your quest to treat foraminal stenosis pain? And what hasn't worked? Leave a comment so we can support each other on this journey to better health and a better quality of life. If you found value in this video, please like and share it. The next foraminal stenosis video you should watch is this one where I show you 5 great exercises specific for relieving pain associated with foraminal stenosis. Please go watch the video next.